Welcome back to Bright Ideas from Acuity Brands on IndustrialSage. Coming out of the 2020 pandemic, hospitals, doctors' offices, and senior living facilities are under a microscope. Today, I'm joined by Tara Belloni, a sales manager focused on healthcare spaces, to talk about some new lighting technologies for these facilities. Tara, thanks for joining me.
Thanks for having me, Catherine.
Let's start. What are some considerations, maybe some primary considerations for lighting a healthcare facility?
Sure. Currently, healthcare facilities face some of the most unique challenges for many projects that our design partners will be working on. We no longer can take a cookie cutter approach when designing these spaces, but we have the ability with current technologies and controls and LEDs to really design around the needs of the patient rather than what was traditionally just the quickest to complete.
And can you elaborate a little bit more on those different healthcare spaces?
Yeah. So when we think about healthcare, I know right off the bat, a lot of people think about hospitals being the primary focus. Remember that there are a lot of other types of healthcare facilities that are both inpatient and outpatient that we need to take into consideration. And we can divide those into two separate groups, one of them being acute care facilities. And that would be where the patient is receiving active but short-term care or treatment after maybe a procedure or maybe they've had some sort of accident. And then there's also chronic care facilities or long-term care facilities. And that would be a facility that provides rehabilitative, restorative, or ongoing skilled nursing care to patients or residents that really need some help with just basic daily living activities. People are living longer than decades before, and just naturally with age promotes the onset of health concerns that we have to take into consideration when designing. Over time, people's lenses just naturally begin to yellow, and that changes the amount of light that we need to bring into the patient's space. And this can kind of trickle into impacting someone's circadian rhythm of the occupants of that healthcare space as well. But just as lighting practitioners, we need to be able to incorporate things such as tunable light systems, bringing in natural light and daylighting into these spaces, and then also just adding in really easy and intuitive controls for both the healthcare professional and then, of course, the patient.
I like what you said there, being a lighting practitioner. What do you think is the role of lighting in healthcare facilities?
Yeah, it definitely plays a major role, and we really have the ability and a lot of flexibility to improve overall outcomes with these patients and help them on the road to recovery. But we take into consideration some key things, and first and foremost, we are keeping at top of mind patient safety. We really want to do everything we can to minimize patient falls in these facilities by providing really adequate light levels. But also by having adequate light levels, we want to make sure that the staff is properly evaluating these patients and medicating them properly. Lighting can also support circadian rhythms, provide means of entertainment, but it can also be very calming and reduce stress and just act really as an overall mood improver and act as a positive distraction. And then just lastly, patient empowerment. We want our patients to still have a sense of autonomy in spaces that can often be unfamiliar to them. And we can do that through different lighting controls. But there's so many different types of spaces in healthcare facilities, and just naturally, each of them are going to present their own set of challenges to us when designing.
And can you examine those a little bit more, maybe elaborate more room by room?
Sure. And there's generally 3 to 4 spaces that we really want to hone in and focus on. And that would be patient rooms, surgical suites, MRI suites, and then also behavioral health spaces. But I'll start off with patient rooms because, as you can imagine, they are very plentiful in healthcare facilities.
Definitely.
But in patient rooms, we want to make sure that we have the proper lighting for anyone of any age and also have adequate levels so that the doctors and staff can properly evaluate and examine those patients. But we also want to incorporate very simplified and intuitive controls to also provide some sense of autonomy and empowerment for our patients while they're having their stay there. And then also surgical suites. These are probably the most rating and listing strict spaces within a healthcare facility. And that is because we really want to make sure that our luminaires are sealed for infection control. But we also have to take into consideration some of the large scale equipment that is going to be in this space. There's lots of different items that will be in the room and also attached to the ceiling. So our luminaires need to also be able to accommodate for that. And then another trend that is very common in surgical suites is incorporating green LEDs. And we incorporate green into surgical suites because we have our highest level of visual acuity underneath green LEDs.
That's
and
interesting.
that draws a lot of attention to detail, but it also does an excellent job of reducing glare on monitors. And in surgical suites, there's lots of monitors that the entire staff is going to be looking at during that procedure.
Mm-hmm. And then you also mentioned MRIs.
Yes. So in MRIs, these are areas where we have very costly equipment and a very sensitive procedure is going to be happening here. It can be rather intimidating for a person who maybe has not had an MRI before. But the luminaires that go into MRI suites need to have a non-ferrous construction. So that means that they're non-magnetic so that they won't be interfering with any of the imaging that is taking place. But the luminaire should also provide a really smooth, flicker-free dimming, and the drivers need to be able to be remote mounted, meaning that the drivers won't be in that space, they will be stored somewhere else, and also accommodate that DC current that's coming into the space because that's going to be what that large-scale equipment is going to be running off of.
And you also mentioned behavioral health. Can you tell me a little bit more about what those type of spaces are and their needs?
Sure. Behavioral health can be a mental health facility or can be any sort of rehab area that can provide short-term or long-term care. But we would classify these patients as high risk. So we need to take extra precaution when we are selecting the luminaires going into these facilities, especially making sure that they are ligature resistant, that they have no graspable edges or reveals on them that we're adding into that space. But unfortunately today in North America, there's no national ratings, listings, or standards when it comes to behavioral health facilities. But luckily, there is a growing body of research that's creating guidelines for us and really points us in the right direction of what luminaires we can incorporate into these spaces. But historically, aesthetics were not really a primary focus of these areas,
right.
But we've come a long way and we're adding in more residential feel luminaires. So it's less of a healthcare focused space, but more of a residential feel for these people who are staying there.
So it really, every single different healthcare space is very unique in what their needs are. Is there a way you would summarize all of this up into how lighting plays a role?
Sure. And that's absolutely true. I mean, we cannot take one single approach to an entire healthcare facility. We really need to customize it space by space. And we can do that through a luminaire's controls and aesthetic appeal, and really focus on the patient's overall experience in that healthcare facility. And we really believe that taking this approach to the patient's wellness will even expedite healing. So that is always going to be our key focus by incorporating daylight and different views and color to even just make this a better experience for not only the patient who is there, but also the staff members who spend many long hours there and also any visitors who are coming in.
Mm-hmm. Well, Tara, thank you so much for joining us. A lot of really great information you shared today.
Thank you so much. Thanks for having me.
Absolutely. We are going to connect this conversation with our discussion of UV lighting in our next episode. Please join us.